Abusua sese deɛ amanfoɔ bebree na complaining sɛ wohwɛ Nana Addo Dankwa Akufo-Addo ne last 4 years from 2020 to 2024 na ɔyɛ president wɔ ɔman Ghana mu a wohwɛ ɛkwan a His Excellency Nana Addo Dankwa Akufo-Addo de Ghanafoɔ faa so Ghanafoɔ bi kyerɛ mu a the last years of Nana Addo Dankwa Akufo-Addo no saa time no na ɛyɛ adeɛ sɛ utu Nana Addo Dankwa Akufo-Addo fubia na onti sanso na wo criticize no in any way a enya ade a na otie criticism eboa ema amamu a no wobu oman no ema no ekonanim na no na amanfo akire mu se wohwe His Excellency John Dramani Mahama ono nso ne second coming from 2024 to 2028 amanfo bi akire mu se ono nso ni initial stages yi a wahya ase a obu oman no the same procedure na His Excellency John Dramani Mahama enso nam so amanfo bebre na ekire se oma complain afa ekwan bi a His Excellency John Dramani Mahama ebu oman no nanso asat now there kame akoye se gonja ni de shokonkono abu nani agu saa complaints ni nyina so a enya asenketo na anu ada nyina yahu se His Excellency John Dramani Mahama ebeye president wo oman ni mu workers bebre na aba abonte a omaba be complaining on how the new system and say the new reset no emboa emo madwuma enkoso na anu ada na nurses for de omo de ebeto ho a na omo chese ye ti omo ka ene ade teachers for nyina nso de omo de ebeto ho no mu a enya asenketo na nsem ntem baako a aba beto dwa a chese ashoki Ghana for nyina no the fact say farmers for bebre esun charge ajo omo chese sise de omutimi ekwati omo nuama ne begu honum na obia embeto ni nyina ne say despite the fact say prices of omo farm products no aba from a say sika omunya edi free omo farm product ni mu no omuntimi emfa nya hwe emma omo ho no aside that no farm product no nso timi begu honum na omunya tofo mpo we nyina no complaints ahodo a amanfo ka edi acha His Excellency John Dramani Mahama enti ebi mu kire mu a the second coming of His Excellency John Dramani Mahama kame akoye se enioma bebre aye basaa even though say enko yanim enko baabi anso amanfo kire mu a sese amamuo no according to them omuhu ne say age His Excellency John Dramani Mahama nsemu a enya asenketo a nsem omo de dodo na aba abeto ho no mu a besese bebo awrem na omo ankasa no mu asem no yakọ ni akotie ni eba de aka nyina no de ato am so.
The dead ghost syndrome still applies. So sometimes you just ask yourself, is it even worth it coming out to come and say it to the hearing of Ghanaians? Because Ghanaians know what they were opting for. I mean, 80 years. Just say, John Mama 1.0, no. 1 hour, 18, you are around 12 years. 12 years, Akolano. I mean, if your light is going off, you should know that you are having doom so, and then, what else? That there is heat in the room. So if not anything at all, if you cannot remember the fast and for 9 and all those things, at least you could remember that as a 12-year-old, there was no light for you to even learn. And some of these 12 years, 13-year-old were the ones who were writing BEC and Mahama 1.0. So you should remember, say, you could draw BEC Monday, Tuesday, no. You could draw paper biom, not light no. It's Monday, and you use candle to learn. Some of these things you should be able to remember. But I mean, they all still went to vote. And then the I won't vote syndrome also. I said, to say, ammonia, laughing gas. The I won't vote syndrome, no. Ammonia, laughing gas. And see, I don't know how they were able to spread it all across the nation at once. Everybody inhaled it. I won't vote, I won't vote, I won't vote, I won't vote. And I won't vote, I won't vote, I won't vote. And the I won't vote has happened to all of us. Now who cause them? So now who cause them? We all cause them. No be so. So we will all live in it. Ebusianfo, let me start with Mita Akado. Minta Akando, aka Danny Hall Prefect. Minta Akando C. They have been able to restore patient data. So, Minta Akando C. They have been able to restore patient data using data from National Health Insurance. And this was well captured by Joy News, I believe. I want to bring it to you so that you see that I'm not lying. Akando said that, hey, said patient data, they have been able to retrieve it. How did they retrieve it? Through good desire. So this is it. Minta Akando, Air and Brand News. Or see, Lim Saga. We have reconstructed not less than 16 million patients' data from the National Health Insurance to ensure patient data is not lost. Akando. I read again. We have reconstructed. Now, Oba Health my FIB be reconstructive surgery. Let's say for instance, biibiaa, and then unfortunately for you, you have lost maybe the flesh on one side of your face. And the surgeon said, if you should leave your face like that, no, you will not be able to even leave it yourself. We can do reconstructive surgery, and we can pick your skin. We call it drafting, yeah. So we can pick your skin, maybe from your ass, your buttocks. You peel off the skin on your buttocks, and then we use down to cover the part of your face that is exposed. That is called reconstructive surgery, right? There are times that for some procedures that they need more skin, they are able to dilate even the skin of the forehead. Okay, they are able to dilate it so that we can cut some off, the excess off after some time, to put wherever, to patch wherever it is. And Tiakando say, Ghanaians, I mean, anybody who requires a health assistance or your hospitals, your patients, they should not be worried. Don't be worried. Esan say, he Minta Akando, leading Ministry of Health, they have been able to reconstruct not less than 16 million patient data from the National Health Insurance. Now, when I saw this, I realized, number one, and I said, Ghana and Kasano, you have a big problem. We have a serious problem. And this problem that we have, sometimes I tend to forgive common floor members, Bankro from journalists. Journalists for I expect most of the time said they will do better. So Joy News is telling us, say, it is true. The minister has said this, but what does Joy News know about what the minister is saying? You don't have any view about it. See, last year, 2024, almost all these media houses that today we are seeing that they are coming up with uniform, titles and captions. Almost all of them last year, they turned themselves into fact checkers. Akufa do kasia, they come and sit down, say omu fact check it. Baumia kasia, they come and sit down, omu fact check it. Then they will leave NDC and their cohorts to say whatever, to spew whatever they want to spew and go away with. So I was thinking, say, okay, per the Ghanaian media analogy, you only fact check the government that is in power. If indeed it is that you only fact check the government that is in power, then government that is in power, NDC. And it's a NDC for And I say government appointees, yedi taxes etiom. Ever bonti be kasembia. The media owes it a duty to go and say, see whether the media, the minister is saying is true or not. Number one. And he say, what is expected a year of national health insurance? Yen say, health insurance as we have it, it does not keep what we can term as patient data. You, our health insurance, no, it does not keep what we call patient data. Let me explain to you. People, they are afraid of chronic disease. And acute disease. Acute disease, no, wait now, afraid baby say malaria. STT and started feeling feverish first day, second day, no call hospital, second day, no draw. By 6th day, no, now be fine. Acute condition, no. Obinsu owa need ni yari no chronic. Ewo till thy kingdom come. Ebia hypertension. Or see nipa no BP. Obi or BP you don't treat it once. I'm on a drain and say there be. So the person has to repeatedly keep coming for their medication until their kingdom come. Yari pe brewo wa chronic conditions. Now me talk kind of say uko hospital. Now ebia dry trauma or no. It is covered by health insurance. Health insurance has to keep a record of that medication. Ebia udi malaria ne buy. And we gave you diclofenac for pain. Now sa diclofenac ayede ma no. Covered by health insurance. That hospital has to keep a record. Say, yeah, ma, if they are the voice of MPP diclofenac, so the government can pay them back. How do you use this as a way of reconstructing patient data? Minta Kando, what is wrong with you, Mr. Minister? I don't get it. How do you tell me this story? Now let's take for instance, say, a drobit is say, diclofenac can make one a year for pain. How are you able to tell, say, the pain is in the chest, the pain is in the mind or the head, the pain is in the leg, the pain is in the thigh? How are you able to trace it? How are you going to trace that to tell me, say, you have used national health insurance to reconstruct patient data? Mita Kando. You have to get serious, Mr. Minister, Honorable Minister. You must get serious. Let's say Obiba Hospital, and I try their caps tramadol 50 milligram money pano say onkoto, and I say the person needs it, the person requires it. All right. Now, ebia sa caps tramadol 50 milligram no, captured by health insurance. So they keep it say okay, so and so was given a caps tramadol 50 milligram at this point in time. How are you going to use that, say, because caps tramadol is for pain, no? And a pain, a broken bone, and I say fractured something, and I say a muscular tear or something. There is no way you can tell that. And it's Obiba Hospital now, maybe a one-time diagnosis, sir. How do you use that to tell me, say, you have used that data to reconstruct the person's health history? What Minta Kando does not want to admit, me say, a lot of Ghanaians are dying as we are speaking. And they are not dying of hunger. And yes, I come neku omu. Yes, I do so neku omu. Yes, I eja neku omu. Omu history. A medical history, no. And ni hobium adentia Minta Kando has single-handedly abrogated contract that was between the government of Ghana and a private contractor that was keeping our medical records. Now, when he was going to abrogate the contract, wanyenu nyasankwemu debi okoyenu buga buga. And chokoyenu buga buga no nipa. As in Crawford, your company na your medical records no. So say okay, say obey no gidi there. Yen fa data I mau. And one no. This is all that happened, and I say, this is all Mita Canada does not want to tell you. It was possible, say, Mita Kando, a health minister, no, he could have gotten back the data. Whatever data was on the limbs, and for health history. Say, okay, we still say and say, no, our BP. Now, our BP, no, ebia normal saline. You don't have to give him normal saline. You give him the other one. And I said, wait, don't give this one to him. You give this one. All those ones, no. Those records are records for over 6 years. Records for the past 6 years. Mita Kando, because on him diplomacy. Mita Kando, on him diplomacy, he has succeeded in messing it up. And we are very diplomatic and we are good planner. Unem say, Ebia Papa we no, and I say Crawford we no. I don't want to renew the contract with them again. You start planning ahead. I got 3 months. Wow, unem say, okay, after 3 months, me renew my contract so. But data no ewo. So how do you get the data? You become friendly to them. Then you start telling Ebia IT4 or more hospitals and say, Ebia start creating a backup of all the patient data at the various facilities. We all microphone who there be when you say 3 months and see who person was say yes sir. So every hospital will start creating a backup. So by the time the people realize you have your own set of patient data backup, they can come and tell them, say, okay, say that your person has a new contract, no bill. That way you say you have been tactile. We use you again. But to sorry preoccupation there be togbe mupo